HM is concerned with each of our business partners, their employees, and their family members. The information today is provided to help navigate through the information each of us are exposed to every day to provide tools to address this important concern in your workforce. On March 11th, the World Health Organization has characterized the coronavirus, also identified as COVID-19, as a pandemic. Although that term can cause concern, they have advised that this status change does not change the World Health Organization's assessment of the threat the virus poses or the course of action countries and individuals should take to control the spread of the disease. They advise the virus can be suppressed and controlled with a few key actions by each individual. As an employer, our role is to provide credible and reliable information to our workforce. This education is the number one thing each employer can do to address this concern in their organization. The coronavirus has brought the topic of infectious diseases to the forefront of the news media. What information is credible and which is not? How much information is too much information? Our role as an employer is to inform our staff about reports that are coming in, however, to do so only from credible sources and often. The frequency of the information, though, can be in many forms, educating our staff without causing unnecessary fear. Let your staff know what they can expect from your company as the risk progresses. Individuals want to be informed and know that their employer cares, as well as knowing their employer has a plan. Provide periodic updates to keep information such as prevention techniques top of mind, but not inundating staff with information. Inform by the use of different mediums. Placement of posters at strategic places around the workplace, such as bathrooms, break rooms, and wash stations, can be very helpful. Email information on updates on a periodic basis, or when information is time sensitive. And provide printed information for employees to share with their families. Plan for possible outbreak at your organization. Consider the impact of a disruption in your workforce and possible ways you can plan now for a staffing shortage. Develop an infectious disease response plan. Create a plan for your organization. The why, what, how, when, and frequency of communications from reputable sources. And remind staff members on the benefits of their benefits. Many carriers are waiving all deductibles, coinsurance, and copays related to COVID-19 diagnostic testing in an effort to encourage medical treatment early and to prevent the spread of the disease. Telemedicine and virtual medical options are also available through all fully insured carriers, and most self-funded plans also offer benefits for remote treatment while individuals practice social distancing. Whenever your employees may be exposed to an infectious illness, it's important that we as employers do as much as possible to prevent the spread of the illness should our workforce be impacted. Since the coronavirus and the common flu are spread mainly from person to person, making sure someone that has contracted an illness takes precautions is the key to minimizing the spread. From the CDC, a few quick things we can do to help address the issue for our staff and their families. Stay home until fever-free under 100 degrees or less for 24 hours without intervention such as fever-reducing or other symptom-altering medicines such as cough suppressants. Separate sick individuals. Employees who appear to have respiratory illness symptoms such as coughing should be separated when possible or sent home as soon as possible. Also, think about your reception area and common areas, making sure seating is arranged, when possible, 3 feet apart to create this safety barrier for your clients and visitors. Educate on health etiquette. Cover your mouth and nose with a tissue, or cough into your elbow, not your hands. Wash your hands with soap and water, or use hand sanitizer with at least 60% or greater alcohol content when washing is not possible. We've probably heard these steps to preventing the spread of an illness often recently. However, continued repetition of this information can help change unhealthy habits. The greater importance employers place on simple techniques to preventing the spread of illness now, as well as throughout the year, the greater impact the training will have long-term on the health of your team. The CDC has training materials at their website to assist employers with communicating prevention techniques to your staff. Keep the work environment clean. Surfaces that come to mind are often the faucets in the restroom, handles on doors to our building, but there are often forgotten areas that also need to be addressed. Common rooms such as conference rooms, copy and mail rooms need to be a high priority, as are the copy, fax machine, telephones, when there is a possibility of multiple people accessing the same equipment. And our personal cell phones, an often overlooked area for the spread of an illness. Providing hand sanitizers in common areas and providing disinfectant wipes for communal use can help everyone to keep your worksite clean and safe. Educate on precautions when traveling. There are resources on the World Health Organization and Centers for Disease Control website for areas where extra precautions should be taken, as well as tips when business travel is necessary. And inform employees on risk assessment for their own family members. Taking an extra step of educating employees on the early signs and symptoms of possible illness, not only for themselves, but when they identify possible symptoms from family members, can help them identify potential exposure so they can consider alternative work arrangements that may be possible should the need arise. Many companies have already begun to feel the impact of the virus on their business operations. Questions have begun coming into the HM teams asking what they can do as a company to address the disease and lessen the impact on their business. From the CDC, employers should monitor the disease in their community. Knowing the true number for your community can help inform your staff and prevent the spread of inflated numbers or rumors throughout your workplace. Prepare for absences. Each year, the seasonal flu affects us all. Since this virus has a longer infection period, employers are encouraged to consider the impact of longer-term absences, not only for general staff, but in the event key positions may be vacant for an extended period of time. Identify those essential business functions and vendor disruptions that may be impacted. If any of your staff travel for business purposes, whether internationally or regionally, consider placing a moratorium on business travel for the time being. And stay informed from local and state health officials on the virus in your local community. Many companies have reached out to us regarding whether they are insured for losses experienced due to supply chain interruptions, business operation stoppages, inventory surpluses due to delivery challenges. There are many factors to consider in light of a significant business impact caused by a communicable disease striking your workplace. Business income policies are designed to provide coverage for the actual loss of a business income due to necessary suspension of operations directly caused by a covered loss. The definition of a covered loss in most policies, however, exclude losses due to viruses, bacteria, or other microorganisms causing illness or disease such as COVID-19. Before your company is impacted by such a devastating concern, it's important to take time to review your existing policy language to understand where coverage may not meet your expectations. If there are any questions as you review your policy language, please talk to your commercial HM team regarding any exclusions that may apply should your business experience a loss. Your human resources team is an important communication resource for your staff and your management team, addressing policies and procedures that apply should your staff be impacted by the virus, ensuring employment actions are consistent and compliant with local, state, and federal laws, and addressing common concerns in the workplace. Does your handbook contain a communicable disease policy? Are employees aware of how absences due to virus contamination will affect them? Many employers do not have a current policy addressing expectations should infectious disease impact their staff. It's important to consider whether such a policy can be beneficial to not only providing your staff guidance on how to address a situation should they feel they may be contagious, but providing a roadmap to your management team in addressing situations as they arise. Should an extended absence be necessary by a staff member, are there possible accommodations such as remote access available? Are your timekeeping systems set up to track time for non-exempt staff working remotely? Considering these questions and addressing for all positions before a need should arise can be instrumental in an action plan. We've all probably heard the term social distancing related to this recent outbreak. Employers are encouraged to create and revise existing telecommuting policies and consider flexible work schedules to alter times staff may be interacting when possible to minimize potential contamination. Does your safety manual address illnesses contracted through work exposure? Most instances of an individual contracting an infectious disease cannot be tied directly to work exposure. However, it is a possibility. Knowing how to handle such a claim should an instance occur is an important consideration for your HR or safety team. Most policies address an employee's absence due to their own health, but what about if they're out due to an ill family member? How does your absence policy address instances when an employee is healthy, but misses work due to school closure? Ensure that your existing policies are consistent with public health guidance and employment laws is very important at this time. We all know of staff members who will come to work even in their worst health day. Oftentimes, financial concerns are what prompts ill employees to come to work rather than staying home until they are well again. Some employers have implemented a temporary addendum to existing policies in light of the coronavirus impact. Extending paid sick leave or providing additional paid time off on a temporary basis are a couple of short-term strategies some employers are implementing to ensure their workforce stay home when they're sick, however aren't financially devastated by an extended absence. Remind staff of anti-bullying and anti-harassment policies that apply in all situations. The Equal Employment Opportunity Commission has provided guidance for employers related to anti-discrimination laws under the American Disabilities Act regarding reasonable accommodations and medical examinations and inquiries. Employers need to make sure when they are addressing a communicable disease in the workplace, as well as any other condition that may affect their workforce, that anti-discrimination rules apply. Make sure questions are job-related and consistent with business necessity. If your company has a reasonable belief that the employee poses a direct threat to the health or safety of themselves or others, an employer may send an employee home who displays a symptom of a contagious illness without violating the American Disabilities Act. However, asking employees who recently traveled to an affected area to remain away from work, even when they have no signs or symptoms, could run the risk of implying the employee may have a disability and imposing American Disabilities Act protections. Remember that any information gathered related to a medical condition must be maintained securely and separately from general personnel files. Also, employers are advised to refrain from announcing that a specific coworker has been exposed or has contracted an illness. Instead, the focus should be on educating staff and on illness prevention. The Fair Labor Standards Act impacts accommodations a company may provide to non-exempt employees affected by the virus. Do we have time tracking ability to capture all time worked for non-exempt employees, even when they're working remotely? Are we handling the absence of exempt employees correctly after their paid time off is exhausted? Handling pay deductions correctly during this time is very important in complying with FLSA requirements. Employees suffering from symptoms or caring for a family member may be covered by the FMLA. If your organization is required to abide by the FMLA, be ready to address possible additional instances when FMLA may apply, sending eligibility notices in each instance, and educating supervisors and managers on the triggers to FMLA so the required notifications can be provided timely. If an employee contracted the virus through exposure while at work, there could be workers' compensation claims impact. The National Labor Relations Act may also have an impact if any of your employees raise collective concerns about working conditions or changes in operations due to the virus. Hopefully, the impact will not rise to the level of plant or location closures or mass layoffs. However, if they do, and you employ more than 100 employees, remember there may be advance notice obligations under the WARN Act when more than 50 employees are impacted, or when more than 33% of the workforce is impacted. Overall, confidentiality must be protected in all situations, not identifying employees who may have been exposed, not releasing information related to an employee's health status to those without a business need to know, etc. There are many obligations that we as HR professionals need to have top of mind when addressing these out-of-the-ordinary situations. We want to share some common concerns that have been asked at the HM offices recently to hopefully address questions that may arise at your company. If an employee is showing a sign of a communicable disease, an employer may require the employee leave the workplace. If the employee is non-exempt, the time missed is not required to be paid time off. See state legislation, though, for specific state leave laws that may apply. It's recommended that if an employee has been provided with credible information and voices fears of traveling for business, consider the reasonableness of the objection to not traveling and whether an alternative option, such as teleconferencing, may be possible. A doctor's note can be required if the absence is in accordance with a policy requiring such documentation. If your sick policy, however, does not require physician documentation until a specified number of days have been missed, it's recommended that an employer not require a note outside of their policy requirements. Employers are advised to follow existing protocol. Ask the minimum amount to determine if any leave policies may apply. Steer away from any questions that may result in a disclosure of a disability. With such an important topic, there is a chance of misinformation to create fear or unnecessary concerns. Credible information is extremely important to counteract the misinformation our employees may be exposed to every day. Credible sources for creating your policy communication include the Center for Disease Control website provides situational updates, symptoms, prevention, and travel information. The World Health Organization provides continuous situation updates on the coronavirus worldwide and other topics of world concern. Video training materials and media resources, technical guidance, and advice on traveling is also provided. The Food and Drug Administration provides information on fraudulent product warnings, personal protective equipment supply status updates, and White House briefing information. The Occupational Safety and Health Administration provides hazard recognition, OSHA standards, and how they may apply to the virus. The Equal Employment Opportunity Commission provides compliance tips for the American Disabilities Act and the Rehabilitation Act. The National Library of Medicine provides education for the public, as well as healthcare professionals and educators, and interventions and treatment information. The Society for Human Resource Management is also a great resource for human resource professionals in addressing and communicating this concern for their employees and staff. And very recently, the Missouri Department of Health and Human Services announced a hotline now available 24 hours a day, 7 days a week. This information is a great tool to provide to any staff members that may have questions or concerns related to their specific situation. At HM, our clients are our top priority. We hope this information is of assistance as your organization addresses this unprecedented health concern with your company. Your HM partners will continue to monitor the situation and will keep our valued clients updated as additional information becomes available. And please reach out to your HM team should additional assistance be needed.